Hi, Kevin Henry, the Group Editorial Director for Advanstar's Dental Division and Dental Products Report, and I'm on a Google Hangout today with Dr. Jonathan Ferencz. Dr. Ferencz, would you take just a minute and introduce yourself to our viewers?
Sure. I'm a prosthodontist in New York City. I've got a private practice in Midtown Manhattan, and I have a faculty appointment at New York University College of Dentistry, where I'm clinical professor, and I've recently been named clinical adjunct professor at the University of Pennsylvania.
Congratulations on that.
Thank you.
I know we're going to talk today about digital dentistry, and I kind of wanted to pick your brain a little bit and kind of see where you thought we are as a dental industry in terms of digital dentistry and where you think that we're going.
This is really a fascinating change in dentistry. I actually think it's the biggest change in prosthodontics since in my 40-year career. In many ways, more exciting than dental implants. What's also interesting is that it's not a new technology. The technology was introduced in dentistry in about 1985 by actually the first idea was in the 70s, created by Francois Duret in Paris, but Werner Moorman produced the first clinical functioning CAD/CAM system in the mid-80s. And during that 20-year period of time, digital dentistry did not really gain an awful lot of traction. But suddenly, within the last, I'd say, 2 to 5 years, it's really exploded.
And what would you say are some of the reasons behind that explosion?
One, it's probably because scanning technology's improved a lot. Two, computational power has improved tremendously. You know, computers are doubling in computational power every couple of years, and I think that kind of change technologically has changed digital dentistry considerably. What's interesting is just yesterday, less than 24 hours ago, I was in Germany at a Quintessence meeting, and I was seated with Professor Moorman, the founder, the creator of CEREC. So he was talking about the early years of CEREC, and the early years, people who were the early adopters were dentists who were fascinated by the technology, but many of whom were willing to overlook the clinical results being rather mediocre. Today, the clinical results are outstanding, truly outstanding.
You mentioned the Quintessence Symposium that you were just at, and I know there's another one coming up, I believe, in Orlando. Could you kind of give me some of the highlights of that upcoming symposium and what you're expecting from that personally?
Sure. This is the first global symposium on digital dentistry, and it's what's really unique about it is that it's not driven by industry. It's not driven by one system. There have been many conferences in the past, conferences sponsored by CEREC, conferences sponsored by E4D, now PlanScan, that kind of are limited to those people who use those systems. What's unique about this conference, and I'm flattered that I was chosen to be the scientific chair of it, one is it's a true partnership with Quintessence and Henry Schein. So Quintessence is a company that's devoted to open architecture in dental education. But Henry Schein is devoted to open architecture in product sales because it sells lots of competing products within the same segment. So to be able to convince both the executives from Schein and the executives from from Quintessence that I want this to focus on open architecture, not on equipment, but on workflows that truly benefit the patient, it was really a very, very easy sell. When I started to put names of individuals down on paper, I was surprised to find a response from Quintessence, which was, gee, I've never heard of any of these people. And my response to that was, that's terrific. That's exactly what my goal was. I don't want the people who commercially lecture for companies to be the focus of this conference. There'll be plenty of opportunity for companies to display their wares. There will be a pre-symposium day where they can be as commercial as they want. But for the 2 days of scientific session, when the meeting actually starts, the focus is going to be on digital technology and workflows that produce better patient outcomes.
And do you find that peer-to-peer learning is often the best way to do it in the digital dentistry format?
I actually think it's the only way. We're not talking about a product that a sales rep could introduce to a dentist. He could try it, it instantly works, and he's off and running. We're talking about a technology that represents a significant investment, an investment in terms of dollars, but also an investment in terms of time. The learning curve here is very significant, and no one except for a user can really understand the types of problems that we frequently encounter and then what the solutions are. So I find that when I have a problem, sure, we might call tech support, but typically the quickest solution I get is from a colleague of mine, whether it's a laboratory technician or another dentist who might be using the product more than I have used it or is better skilled in a particular aspect of its use.
That's very interesting to hear. And last question before I let you go. I know you mentioned the learning curve and the cost. Are those some of the biggest roadblocks that you see to why people currently aren't in the digital dentistry workflow?
When I look at the hurdles for adoption of digital dentistry, the hurdles are quite significant. Number one, there are misconceptions. The first misconception is that digital dentistry or CAD/CAM dentistry equals same-day dentistry. It does not. Same-day dentistry is only a part of CAD/CAM dentistry. Perhaps half of my cases are not same-day. So you've got dentists who are afraid that they can really learn all of that. You've got dental technicians who are fearful that their livelihoods are going to be negatively impacted, trying to talk some of their clients into not embarking in the technology. So that's one of the hurdles. Another hurdle is dentists don't like to work so hard on a technology to get proficient at it. So many people are not patient enough. You mentioned the cost. The cost is, no question, is a hurdle, and especially with systems that are closed or sold as a package, that price tag of $100,000 plus can be very intimidating to the average dentist.
Well, sir, I really thank you so much for your time, and obviously wish you the best of luck at the symposium. It sounds like it's going to be a great time and a great learning experience as well for those who attend.
Thank you so much for the opportunity to talk about this subject, which has become a real passion for me, and I'm confident that this symposium is not going to be the first and last. It's going to be the first of many, because this is a field that is going to explode.